Good morning.
Good morning.
Good morning, Dr. Allen.
Today is the 22nd of August, day after the big eclipse day. We delivered your full mouth reconstruction case almost a month ago. I want to quickly check with you how you're getting along and kind of tell your story if you would. And I have Donald here and Stephanie. Without Donald's unwavering support, nothing would have happened. So it's only fitting that you both are in here. So tell me briefly, you came here back in May of 2016, seeking some solutions. Tell me briefly your story and how it ended up coming here.
For well over 20 years, been in pain, gone to lots of specialists, trying to find some kind of solution to take care of the pain that I've been suffering. Given the diagnosis of fibromyalgia, because every morning I was just pulling myself out of bed, I was tired every day, couldn't think straight, and there's probably many things I was suffering over a year ago that I actually don't remember now, because I just don't have the pain that I had. But all these specialists, there's no answer, and the final specialist I went to just pointed out that I was going to have to manage my pain with pain pills.
And what kind of specialist? Is it a pain management specialist or neurologist?
This was actually a rheumatologist.
Rheumatologist, okay.
Yeah, over in England. And
Was it the person also diagnosed with fibromyalgia?
No,
I think that was someone else.
he said fibromyalgia is an American term where insurance company needs to lump you into something. In England, they don't use that term typically.
But is the treatment any different though?
No, it's the same.
They just don't use the label, but
they don't use a label.
They don't use a label. They
Yeah.
basically admit that they can't find a solution to that.
Okay.
But I was taking naps during the day. I mean, I really had such a limited lifestyle. I didn't socialize much because I just had no energy. And ever since my treatment, in the last month, I have much more energy. Socializing, I initiate things. Sometimes Donald actually says no, so it's changed my life. Can play with my grandkids. And I just can't even imagine. Every day I notice the lack of pain, that it's gone.
Perfect.
It was very frustrating for me because I'm an engineer, so for me it was to try and find a solution to all of these problems. So we went to many specialists, and at one point she had an acute trapezius spasm for apparently no reason. So we looked into electrolyte problems, you name it. She's on blood pressure medicine, so were these side effects? We tried just about everything. And I think that what was the last straw for us was really she was waking up now in the mornings with, of course, the usual pain during the day and tiredness, but she also had swelling and numbness.
There was visible swelling on the face.
That's right, like chipmunk.
So this was no longer could we just put up with this. Clearly something was going on that was related to her jaw. And then basically Dr. Caldwell, her dentist, said he knew you and that we...
Kevin Caldwell and Joplin.
Yep. And Dr. Caldwell, who I respected highly as a dentist, recommended that we come and see you.
Yeah. Part of the reason was he noticed that you had no left condyle on the left side. There's no condyle in your joint. So he said, it doesn't look hopeful, but maybe.
Right.
Okay.
Right.
So when you first came here in May 2016, these are the things that you told me was top concerns. Fatigue is number one, back pain, which you attributed to some injury in the past, right shoulder, neck pain, and of course jaw pain, which is what led you to Dr. Caldwell referring you here for a jaw problem. We were looking further.
Right.
So tell me your experience on, because this is meant for somebody that is suffering with some of your symptoms, but don't really have any hope. Somewhat like you may have felt at one point. So Tell me briefly, how you felt when you came here, how hopeful or hopeless you were, anything like that.
I was skeptical that there was anything that could be done.
Sure.
Just because we felt we tried so many different avenues, different types of doctors, dentists. There were dentists that had told us that I could have everything redone and implied that it would make a difference to my grinding, clenching at night. But they never associated with all the rest of the pain. They never put it together.
But they're thinking more in terms of making your teeth look pretty.
That's exactly what I was going to say. Yeah, and it was obvious. They were out for the money because the first question was, other than Dr. Caldwell, was, do you like the way your teeth look? And I liked the way my teeth looked. And so it wasn't that. And, but I could tell that that was more their interest than actually getting to the root of the problem.
From their perspective, they may not have connected any of these other things to teeth. Most dentists, most physicians don't connect this to the rest of your body like we do.
Yeah, and I learned a lot more about how important the jaw position was, or is, and really quite shocked at the difference. I never would have guessed that repositioning my jaw was going to change so much. It's changed balance, it's changed even mobility. My neck, whenever I went to massage therapists, which I did often, physiotherapists, which I did often to try to help the pain, because my shoulders were up here, because everything is so tight. And I just went to my massage therapist last week, and she can't believe how far apart she can get my shoulder from my neck. And so I didn't realize what a difference.
After we came to see you initially and you explained the mechanics of the jaw, I then thought a lot more about how dental work progressively degrades your jaw position, because they really think about just remedying things like decay or replace a cap. And then there was an incident a few years ago where she had one of her caps actually came loose. The dentist just stuck it back in again without doing any mechanical adjustments, and for several weeks after that she had jaw pain. So these kind of clues were beginning to show that the jaw, for me at least as an engineer, was mechanically very important to your physiology.
Sure.
And how you feel.
So we went through some tests and gave you a fairly detailed report of what I found. And then we started off with a reversible trial period, if you would, for 90 days, and which is what we call a fixed orthotic. Tell me briefly about your experience during that period, because you made a big change.
Yes.
See if that making sure it helps you.
Yeah. And that was great to be able to do the trial, because of course I was still skeptical, is this really going to help? And the day after you put the fixed orthotic on my lower teeth, I slept properly for the first night. I woke up in tears because I had slept, and throughout that day I was very emotional because I hadn't slept properly for so long. And also I wasn't hurting the same way. And that was very difficult to get my head around, because it's like, how could this possibly have had this much difference? So I was trying to figure out, okay, did I do something different? But I'd been living with this for over 20 years, so it was obvious that the fact that my teeth were in the right position, or closer to the right position, it made that much difference. So then we just knew we were going to pursue.
Just to clarify for other people, it's not just teeth. Before we figured out where to set the lower orthotic, I had your jaw, neck, all of them normalized or optimized.
Right.
Then we put that in there to hold it.
Right, yeah, when I say teeth,
Sure,
yeah,
that is how
jaw,
we
yeah.
finished getting that accomplished. But prior to it, the important part, of course, was to make sure jaw, neck, everything is as optimal as we can, and then put that position.
Right.
I was very interested in the procedure that you use because, again, I was here for all of your procedures and I watched all of your diagnostics and I was very interested in how you did those diagnostics. And for me, the electromyography and the other things that you did, I found those fascinating and also very credible to me because I could see graphically how the position of the jaw affected those electrical signals to the muscles. And I was just blown away by that. I thought, wow, that's really incredible, fine-grained positioning of in 3D space to find that optimum position of the muscle. I think you called it recruitment, and I was really quite impressed with that.
And your background is as an engineer, electronic engineer?
I'm a telecommunications R&D person, so yeah, with electronics background.
You work with data every day.
Well, I love the fact that you collected that data, and to me that data was crucial. And also, for example, the 3D or the X-rays too.
CT scans.
Imaging the jaw in different positions. I thought that was very important too. So, for me, those diagnostics were very important to me to give credibility to the treatment process.
Yeah.
He was more skeptical than I was because of his engineering background. He's gone, is this hocus pocus? And it's like, but I feel better. And he's
They're both
convinced.
important. Yeah.
Because
I don't know how you feel, but I have the data. It is the objective data that drives my diagnosis and treatment, as you know.
Right.
So then you had more than one option as far as what to do long term. Because of course, once you got past the trial period, and the one that made the most sense to both of you, even though you're perfectly happy with the way it looks, your teeth looked before, it was never a concern for you.
Right.
That was one of the options, is to change the way your teeth come together by restoring all of your upper and lower teeth. We call them full mouth reconstruction. That is the one that made the most sense to you. Tell me why that made the most sense to either one of you or both.
Well, for me, I could visibly see that my teeth were deteriorating. The gum lines were showing quite a lot.
You have bone loss in many teeth.
Yeah, and I used my common sense instead of my engineering background, that because it had advanced and I noticed that it was getting worse. I'd already lost one tooth, I was up to 10 crowns. I knew that just because of my aging and also because of my clenching and my grinding, that it was just going to get a lot worse. And because of the chipmunk swelling every day now and the numbness, I was really concerned. I wanted the optimum result. And I knew that if you have something where you can take it out, and I just didn't feel as comfortable. I wanted, as bad as my teeth had got, I needed 24/7 coverage kind of thing, just because of my lifestyle, and I wanted to get back more of my life.
Yeah, I wanted to emphasize appearance was least of your concern, but the function part. You wanted a structurally sound 24/7.
Right, I do miss my original smile, I have to admit. So it's, yeah, but structurally, I just...
Beyond the obvious.
Yeah.
And the reason is because they're trapped in their specialisms and they don't have time, and unless you find a doctor that is more curious, they're going to miss this.
Yeah. I mean, you hit the nail on the head. They're silos.
Yeah.
They're in their own silos, and the other thing you pointed out is the time. They're literally pressed. So I'm trying to be in their shoes. How would that be if you had to see a new patient or every other patient every few minutes? Like sometimes 5 minutes, 10 minutes tops. I think
Right.
next. It's
Yeah.
kind of almost hard to think, let alone stop and consider.
Right.
So now that you've gone through all of this, anything that you could tell that Stephanie year ago, because we first met you in May 2016, started the orthotic in July 2016, finished the full mouth reconstruction 2017, a year later. Now if you can think back to that Stephanie, what would you tell the Stephanie? I know it was a skeptical Stephanie.
I was a skeptical Stephanie, but I'm also someone that doesn't believe that there's not a solution to a problem. I think there's always, that's why we tried so many places, and I wasn't comfortable with just taking pain pills. I remember feeling completely broken when I was told by a specialist that you just need to manage this with pain pills, because that's not what I like to do.
You also had a lot of devices at home, I think you told me.
Oh my goodness. I have a full physiotherapist office in my basement. I have a lumbar traction, I have a cervical traction, I have every single kind of contraption you can think of. I had something that I wrapped around my head to stop my grinding.
And then
a
you
massage chair.
Yeah, and on top of that, you also still needed medication with all of that.
Oh yeah. I mean, when I add up all the costs there, and then on top of that, the dental costs. Like I said, 10 caps. Well, a cap is $1,500 normally. And then I was needing a bridge, and so you add the dental costs on top of all. There is no way this isn't worth what you get out of it. I mean,
most importantly, that you didn't give up. And I always tell people I can only help people that haven't given up. They
Yeah.
gave up and accepted the repeated advice, accept it and manage it.
yeah.
Then I'll never see them, never have a chance to help them.
Yeah.
Well, I was going to say, and realistically, the last year, you do have to be committed. There's no doubt about it. You have got to do what you're telling us to do to get the optimal results, in my opinion. But when you compare that to how many visits I made to physiotherapists, I was so tired of going to the doctor and wasting my time in the doctor, where it gave me some relief, but not complete relief. I'm not saying everyone's going to get the kind of relief I got, but I came in, I think, saying if you could just give me 20% more of my life back, and I've got like 95% of it back. So
Oh.
Huge difference.
Wonderful. And then you get to spend more time with your grandchildren.
And socializing.
Yeah. And Donald, you wrap it up.
Well, I'm just incredibly grateful. As a professional, I'm majorly impressed with your skills, both your diagnostic skills and also the artistry that in doing the reconstruction of my wife's mouth. Yes, her smile isn't the same as it was before, but it was heading in a bad direction, right? One day that smile would be gone.
Yeah.
And now we have a new smile which is going to be there. We'll get used to it. She looks great.
Yeah.
But it's just that she
I get
wasn't.
plenty of compliments, that's for sure, on my smile now.
And honestly,
Yeah.
there's no hesitation on my side at all. This is fantastic. Really.
Well, you're hoping to have a wife that had a little less pain. I think you got a hot-looking young wife now.
Yes.
And the office staff. You have a marvelous office staff.
And of course,
Oh, my goodness.
for me, it's because, as you said, the siloed professions that we are all in. I'm in a profession that's silos as well, and it frustrates me that we have those silos. They're hard to break down. So finding ways to get the message out, and I admire you for that. I admire that you do lecture, you do go and do free treatments, and you do all that stuff. To me, that's what I look up to as somebody that really is trying to give back. To get others to do this, and I'm doing my part too. Whenever I
We
get
tell everyone.
a colleague that says, well, my wife has got fibromyalgia, she's not doing it, I tell her about you, I tell her about, just go and look.
Yeah.
Go and look, just look at these alternatives. So that's what I would say to anybody.
Yeah.
Well, thank you so much. We feel blessed that we met you, that we could help you. Thank you so much.
Thank you.
Thank you, Dr.